We've changed up the order a bit, as you heard. We're going to start, we're going to bypass admin and finance, come back to it, and do community services now, because we do have a delegation to hear. And first, I will ask for any declarations of pecuniary interest under the Municipal Conflict of Interest Act. All right, seeing none, we are into our delegations, and I'm told Marianne is here. Welcome, Marianne. I think we heard you about a year ago on this issue.
Sorry?
I think we heard you about a year ago on this issue.
Yes, okay. I was. And I hear that the item that I prepared for your consideration is on page 4 of your agenda. I submitted something for your consideration. I haven't contacted any staff or politicians on this issue, but I wanted to come back and give you an update of what had happened to me a year ago. Exactly 1 year ago today, I was at the Landlord and Tenant Board. I have received 2 N5s, notice to evict, based on uncleanliness. There had been what they call fire brats and book lice found in my apartment, none of which are included on any pest control sites, or if you look at Able Pest Control, they will say, those aren't technically pests. Book lice, I had a lot of books. And fire brats are similar to silverfish. But what I did have was bed bugs. And I had documented, had paid somebody to come out and document that I had bed bugs. And it had them probably since October. So this is January the 14th, and I had had bed bugs since that time. I do admit that I have a lot of treasures, I have a lot of books, I have a lot of clothing. So it is difficult to treat for bed bugs, but I'd been treated 2 years previous with 10 other apartment units. On that day, I received some legal advice from Community Legal Services at the corner of Frederick and I think it's Bruce. But they can only give you summary advice. So I had received a couple of telephone calls to help me with my presentation. The property management company had the pest control agent and a paralegal. I had 20 pages of emails, documentation, and other emails saying that we had continually talked about the fact that I had bed bugs and was not being treated. I attended last year's council meeting. It was the end of January, and at that point, we had agreed to consent for an order issued by the Landlord Tenant Board that I was to empty out basically all the contents of my apartment in order for the bed bug contractor to spray. And I also had to have 2 feet around the whole perimeter of my apartment, which means that, in effect, there's 4 feet on either side. I was living in very tight quarters, continually being bit, having trouble sleeping, and my mental state was, I would say, troubled. But I came here because I had the feeling that no matter what I did, I would not satisfy either the contractor or the property management company. At that time, I had been living in that apartment, and it says in the documentation, since 2006. I started renting at $650. It was an affordable accommodation, and with rent control, I was paying $750. That unit is currently being rented for $1,350. I was officially evicted and the locks were changed April 1st. I think the people around this table know that I didn't give up the fight willingly. I fought right till the end. I used every opportunity given to me, and I went weekly to the courthouse to find out when the locks were actually going to be changed. At that point, there was 4 other people either slated for eviction or in the process of being evicted. Two or three left willingly. I have said for your consideration that it was not an equal process, it was not an equal, just place to get, I don't know how, I needed paralegal advice, and it was not available to me because I made $4,000 too much. I would suggest for your consideration that with the affordable housing issues, the private sector will continue to hemorrhage and will have evictions because the landlord-tenant board and the tenants there who attend there cannot afford to represent themselves. And they need paralegal advice. And I'm here today to suggest for your consideration that any affordable housing strategy also has to include additional funds to up the limit so that people who are not financially destitute but are in that medium range to be able to afford paralegal assistance. When I actually had the ability to look for paralegals, the retainer is about $500. They charge about $200 an hour, which isn't outrageous. And what would have been well worth the cost if it would have had a good result. But in looking for paralegals, they said they generally don't represent tenants, that they can't afford to pay for the services. So I was evicted, and I don't think anything I could have done would have avoided the eviction. After attending this here the end of January last year, I did receive some really helpful advice from some of your staff. And there is a company called Empower Cleaning that does help with people who are facing eviction due to bed bugs. But having said that, I don't believe that if I would have avoided that eviction, that I wouldn't have been just facing another one this year. So that's why I'm here today. I wanted to follow up. It's been a year. And to suggest for this council's consideration that if the private sector, which is under a lot of pressure to make money, if you look at the difference, I mean, rent control is rent control. But if my apartment that was once rented for $750 is now being rented for twice the amount, that there's going to be a lot of pressure to evict. And that's all and the only other thing I'd like to say is that, were you aware that Grand River Transit stopped Christmas Day at 7 o'clock? I was visiting grandchildren and grandbabies, had to take a cab home. So I would like for your consideration next year that maybe you let on Christmas Day that give me till 10 o'clock to get home. That's it. Is there any questions? Thank you. Thank you for hearing me again today on the same issue.
I don't see any questions, Marianne. Thank you.
Thank you.
I just have one question. You said that you spoke to staff. Was that? Did you speak to the people who work in the eviction prevention?
It was from community housing, and they were kind enough just to talk to me about the process that I was going through.
I see. Thank you.
Yeah, and they were aware of Empower Cleaning, which actually does help people, but I didn't get in contact with her until well after the eviction notice was underway. So thank you.
We do fund some eviction prevention initiatives, and I'm sure staff will take your suggestion into consideration. Thanks.
Thank you.
All right, we're on to requests to move items from the consent agenda. Are there any? Seeing none, would somebody like to move the agenda items? Councillor Fox and Councillor Harris, all in favor? On to the regular agenda. The first item is community safety and well-being legislation, and Mr. Murray is going to introduce this.
Thank you, Madam Chair. I just wanted to make a few really brief introductory comments, and I'll try to keep them really brief in the interest of time. As we outlined in the report, the region has a new legislative responsibility imposed on us by the province for the region to create a community safety and well-being plan and to have that done by the end of 2020. So there's been lots of discussions over the last year about the work that's needed to do that. One of the first steps in moving forward with that is appointing an advisory committee to provide advice and input to the development of the plan. The legislation is a bit prescriptive about the membership of the advisory committee and a bit prescriptive about the roles and tasks of the advisory committee. Staff have looked at this and recognizing this is a time-limited role. It's basically going to work over the next 12 months, probably 4 meetings over the next 12 months. Our goal is to try to do this in the most efficient and effective way possible. And to try to do that efficiently and effectively, our view was to try to find an existing group or table whose mandate sort of matched this and whose membership largely reflected the required membership that the province is imposing. And so based on that, we've identified the systems change champion table of Wellbeing Waterloo Region as being well suited to play this role. The memberships set out on the very last page of the report. So that's really the focus of this report, is council endorsing that. There's still lots of work to be done to sort out the work plan, how we get this work done efficiently and effectively, how the work gets done between region staff, Wellbeing Waterloo Region, Crime Prevention Council, and Waterloo Region Police, I think, are the key players. So there's lots of discussion going on between Laurie Fiozzi, Chris Sadler, Mark Glode from the police, and others about how to organize the work, roles and responsibilities to make sure this gets done efficiently and effectively. So we'll bring back a subsequent report, likely in March, just providing an update about the work plan, where we're at, what the next steps are. But in the interest of getting on with this, it's important that council takes a step of appointing the advisory committee. So if there's questions about the report, the recommended advisory committee, I or Laurie would be happy to try to answer them. Thank you.
And there are a couple of questions, starting with Councillor McGarry.
Thank you. Through you, Chair. It's more of a comment than anything else. As Waterloo Region Council rep on the Waterloo Region Crime Prevention Council, I am part of the design team that is working alongside Wellbeing Waterloo Region as well as Crime Prevention Council in looking at visioning further. This is something we discussed at our most recent design team meeting as of last week. So I think I'm happy with this direction, but just wanted Council to note that I certainly am on the ground with some of the discussions around community and well-being.
Councillor Urbanovich.
Thank you, and I agree with Mr. Murray's assessment that this group certainly seems like a good group. I'm just wondering, though, because this is a more comprehensive plan, I'm wondering, like right now we've got the region represented on it as well as the CAOs of Woolwich and Kitchener. I'm wondering if, could we use this existing group and extend the invite to the other 5 lower tier municipalities and have them included as part of it as well if they chose to participate? Because this is a permanent, broad scale plan. I think would be good to include the others if they're interested.
Yeah, so we did talk a little bit about that. So I would say a couple things. We're trying, I've used the word efficient and effective. Like, we're trying to find a balance between, being engaging and getting on with that in an efficient way. The bigger the group gets, the just more challenging it is to, convene meetings and have everybody have airtime. In addition to this advisory group, there will be lots of other opportunities for input and engagement, and there have been already. Input to Wellbeing Waterloo Region work, input to Crime Prevention Council work. So, and actually, I had discussions with all of the 3 city CAOs, and they were fine with the CAO from Kitchener representing them, and the township CAOs were equally fine with David Brenneman representing them. So I think we've got a reasonable balance, but be assured there'll be lots of opportunity for all of the municipalities and all kinds of other community partners and stakeholders to provide input to the process.
Okay, because I think that's really important. Like, I think, you know, we can't get to a point where we basically have a draft document and then sort of expect people to buy into it. They need to be brought along as part of the process.
I see no other questions. Just to comment that although, you know, here we are with the Wellbeing Waterloo Region and with the Crime Prevention Council, and I think that it's just another example of how we are ahead of the rest of the province and things that complicate stuff a little bit for us, but I think there's benefits to us as well. Do I have a mover for the recommendation? Moved by Councillor Harris, seconded by Councillor McGarry. All in favor? That's approved. Next item, 5.2, the Region of Waterloo's response to the provincial modernization of public health, and I believe Ms. Shorb is going to speak to that.
Good afternoon, Chair Clark and members of Community Services Committee. In April of last year, as part of the provincial government's budget announcements, the Ministry of Health and the province made announcements that would significantly change both the funding and structure of Ontario's public health system. Following widespread concerns and feedback from health units, municipalities, and also various stakeholder organizations, the government announced a pause in the changes to funding models and launched a renewed consultation process with municipalities, boards of health, and other partners within the public health sector. Consultations were launched last November and consist of an online survey, acceptance of written submissions, as well as in-person sessions that will happen across the province. The consultations have been characterized by the province as a reset on the discussions with no predetermined outcomes. This report before you today is the proposed response by the Region of Waterloo to the discussion paper, Public Health Modernization. The consultation paper identifies 4 key challenges that the province is attempting to address in their transformation. The challenges include insufficient capacity, misalignment of health, social, and other services, duplication of effort, and inconsistent priority setting. In today's report, there are 2 key themes or takeaways. First, that the strengths and challenges in the public health sector do not exist homogeneously across the province's 34 health units, and as a result, a one-size-fits-all approach is not appropriate. And also, Region of Waterloo Public Health, with a population of over 500,000 and a history of effective and efficient performance, is one of the province's strong and sustainable health units with a size that allows it to have a critical mass on its own. Regarding the stated challenges, we are in agreement that there are opportunities that all health units would benefit from, including reducing duplication of effort and improving consistency of priority setting. However, it is our belief that with respect to Region of Waterloo Public Health, both capacity and alignment with health, social, and other services is actually a strength within our current model. Consistent with previous reports to Committee and Council, today's report indicates that the province should reconsider any plans for implementation of a one-size-fits-all approach to governance and structure for public health units in Ontario. That priorities should be established and changes should be implemented in health units or areas of the province where there are identified concerns. Where issues do not exist, Region of Waterloo does not believe that changes to governance and structure are necessary or helpful. And finally, our current fully municipally integrated model serves the community and its residents well in Waterloo Region. The report includes 5 recommendations for committee's consideration. And with that said, we would be pleased to answer any questions at this time.
Thank you. Chair Redmond.
I would be really happy to move the recommendations when appropriate and just compliment Anne and Shuli on a really well-crafted report.
Councillor McGarry.
Thank you. I also wanted to commend the folks that wrote the report for a very thorough report, and I think very balanced and very needed. I think that the opportunities that exist for the province in order to align the work of the province moving forward and the public health departments in whatever way, shape, or form they turn out is important with some of the research and some of that component. I'm very happy to support this report wholeheartedly. My only question is, do you know where some of the other larger public health organizations are going? Are they, have you been in contact? Are they writing reports in this way, or are we going to be a standalone?
For the large health units in the province, including other health units that are fully integrated into regional governments, I would say that we're fairly consistent with them in that they are also advocating not to make changes where things are working well.
Thank you.
Oh, sorry, go ahead.
Yeah, and if I could just add to Dr. Wong's comments, yeah, I've talked to my colleagues, particularly in the regional municipalities, the regional CAOs, and I would say, perhaps with one exception, all of the regional municipalities are taking exactly the same view, saying this fully integrated approach to public health within a regional municipality is working well and should continue. So it's a very common, consistent message to the province.
Councillor Galloway?
Thank you, Madam Chair. I want to thank staff. A very comprehensive report. And I don't want to go into the merits issue. I and others have spoken on the merits before. The meeting on January 31st is related to this, correct? So is there a is that correct?
Yes.
So is there a strategy that as many of us as possible should attend? Is there a strategy that we want to employ in terms of impressing upon the panel or whoever's coming? Do we have much opportunity for input? I've put it in my calendar. I think it's important. Is there a strategy that we need to discuss or not discuss publicly or whatever?
I don't believe we know the agenda.
No, it's the ministry that's driving the process, so we don't know what the agenda will look like yet.
Except there was one in Peel that
Yeah.
we're likely to follow that model, I suspect, although maybe not.
That's right. Other health units have either made some opening remarks or a presentation, and staff are discussing this now, but we think it would be helpful to have a presentation. Seems like they're going to allow that, and so for us it would be a good opportunity, I think, to pass some key messages up front at the beginning of the session. So that's what we would plan to do. My understanding is that afterwards, the special advisor, Jim Pine, the assistant deputy minister, Alison Blair, et cetera, they would then start asking questions of the municipal representatives and the senior staff. And then it would...
Maybe staff can provide some advice between now and then.
Yeah, no, I think, it's a really, really good question. I don't think we have a good answer for it at this point because we're not sure what the format of the day will look like. So what I would suggest is once we get a sense of the format of the day, then, to your point, Councillor Galloway, we need a strategy. How do we best engage with Jim Pine and Alison Blair over the course of the day? What's the right, best role for councillors, for senior staff to play? And how do we coordinate that potentially with other municipalities who might be there? So we will get back to council for sure. The other opportunity that does exist is, and we'll bake this into the strategy too, there is opportunity for online input, I believe. So that's available broadly to anybody. So we'll work on that and we'll let council know.
What might be particularly helpful, because it's a day, whether or not there's a time more specific that would be helpful, if in fact we would even know that. Thank you.
Chair Redmond?
Just to underscore Councillor Galloway's concerns, this is a very lively topic for the Association of Municipalities of Ontario. I know last summer, some of us delegated and met with Minister Elliott to bring this up amongst some other issues. And I think the fact that Jim Pine was appointed as a special advisor is an encouraging opening that they may be listening to us, and the fact that, as Dr. Wong said, one size doesn't fit all, and I would agree that the reflection of most integrated public health networks into regional councils very much are consistent with the message that we're putting forward. So there are a whole bunch of fronts that we're working on, but your point about showing strength at the delegated session here is a good one.
Councillor Foxton.
Thank you. Councillor Galloway, again, you brought up some really good points. And Mike, you talked about the public can respond online. We need to get that information out, because if we don't, it will be something that people is ignored because it hasn't been highlighted to them. So if we can have some information about that online thing, maybe an attachment, and have all of our municipalities Facebook and tweet it out and make it really well known, so we get public response to this.
I look forward to the speaking notes that staff will provide, however those look. But I think we're pretty clear. I think the message throughout the report was pretty clear that we understand the need to bring up low-performing public health units to a certain minimum standard, but there's no benefit in bringing down the higher-performing ones to meet that lower standard. And we certainly believe we are one of those. Go ahead.
If we're going to do, get people to get involved, can we do in the email or tweet, or the Facebook or tweet, public health provides ABCD, were you aware? You can be a part of keeping public health in Waterloo Region or something like that, but just outline for them, because people will assume they're getting this thing and they're not really sure who it's coming from. So we need to clarify what we're protecting.
Okay, seeing no other questions, there is a recommendation with regards to the report, and that has been moved by Councillor Foxton. Oh, sorry, thank you very much. Already moved by Chair Redmond and seconded by Councillor McGarry. All in favor? And that's approved. We have another similar and not unrelated report before us, and Chief's going to speak to that.
Good afternoon. And through the chair, I'm here to present a PHE PSV 2001 Paramedic Services Modernization Report. The Ontario government is proposing to transform the whole healthcare system, including emergency health services or paramedic services, to improve patient experience and strengthen local services. They envision a connected healthcare system and new models of care that will connect healthcare providers and services focused on patients, families, and community. It's a key to the success of the broader health system that emergency health services be strengthened, better coordinated, and modernized in order to respond to the changing needs in Ontario communities. That is why the government is also engaging paramedic services and municipalities in discussion regarding the new models of care, and that was for PHE PSV 19-10 report that we presented back in the fall, for select 911 medical emergency patients. This would allow paramedic services to expand treatment and transport options on scene to ensure patients are receiving the care that they need when and where they need it. This report is based on findings from the Auditor General, Provincial Dispatch Working Group, the Association of Municipalities of Ontario, and the Ontario Association of Paramedic Chiefs, among others, who identified a list of extensive challenges that affect delivery of critical paramedic services. These challenges are consistent with those outlined in the Ministry's EMS Modernization Discussion Paper, which is attached as Appendix A to this report, and include outdated dispatch technologies, lengthy ambulance offload times and delays in transporting medically stable patients, lack of coordination among EHS system partners, need for innovative models that improve care, and health equity or access to service across regions and communities. The discussion paper raises specific questions on how to address these moving forward and gives paramedic services and municipalities across Ontario an opportunity to provide feedback to these issues via an online survey, which has a deadline of February 10th, 2020. In addition, the Ministry of Health is also convening the in-person consultation sessions with Mr. Jim Pine, the Special Advisor, and Alison Blair, the Assistant Deputy Minister, as another means through which paramedic services and municipalities can provide input to the questions posed for modernization to assist the government in shaping the modernization. Staff from the Ministry of Health have invited the Waterloo region to host a consultation session, which we just discussed the meeting on January 31st. Paramedic Services concurs with the discussion paper's identified challenges, which is impacting our local ability to provide effective and efficient service to the residents of Waterloo region. For many years, the region Waterloo Paramedic Services has dealt with growing offload delay issues, which has hampered our ability to respond to calls for service in the region. This is partly due to several of the issues identified in the report and a lack of progress on provincial initiatives to improve and modernize ambulance and dispatch services, such as delays in the implementation of the modernized dispatch technology. The Region of Waterloo Paramedic Services will participate in both the online survey and the consultation process with Jim Pine and Alison Blair and continue advocating for the above identified issues, keeping in mind our past requests for control over land ambulance dispatch at the regional level and maintaining land ambulance service at the municipal level. There are 7 recommendations contained in the report, and I'm happy to answer any questions you may have. Thank you.
Councillor Lawrence.
Thank you, Madam Chair. I'll certainly move the recommendation. I'd just like to speak to it briefly if I could. Thank you, Chief. Good report. I don't know how many times we've had to say this, but I would say that if this government seriously wants to embrace reform and change and make things better for the citizens in this community, that they would support all of these. And I don't know where we go if they don't after this, but I guess probably a change of government would be the step. But thank you very much. It's a very good report, and good luck with it.
I have one. I see no other questions. We have a sense that the province, well, I think you use the term, there's a reset, no foregone conclusions with regard to public health units. Do we have the same sort of sense on this issue, or?
So we haven't had a reset. We've hit, I think, what we would classify as a pause button for us, and we don't really know what that means. And from a provincial perspective, the Ontario Association of Paramedic Chiefs has been working hard in the background, gathering information and having stakeholder meetings with the chiefs across Ontario to present a position paper to Jim Pine and Alison Blair as well on behalf of the Paramedic Chiefs of Ontario. So that we're trying to keep in step with that as well as we go along, but we've had no indication from the government on any movement forward at this point, from my perspective.
Dr. Wayne?
Just to quickly add, unlike public health, which had an announced plan, for example, merging with other health units, there's never been anything announced in the first place for paramedic services. It was just announced that, they would consult to try to improve the system. So it's at a much earlier stage, I would say, or has been to date. So, so that's why I think the term reset wasn't used, because it really didn't start.
Thank you. Chair Redmond.
Just to add to the conversation, the technology piece of it is huge and something that I think there is a unified response to. I think because, as Shuli has mentioned, it had sort of less structure than the public health did. There's a little bit of more of a broken front, but this too, the Association of Municipalities of Ontario are lobbying to say, again, don't fix what isn't broken. And I think we can make a very cogent case as to why paramedics work in Waterloo Region and need to stay in Waterloo Region.
I see no other questions. There is a recommendation, and Councillor Foxton would like to move that, seconded by Councillor Jowett. All in favor? And that's approved. Thank you. We're on to information and correspondence. Is there any other business? Councillor Rabatovich?
Thank you very much, Madam Chair. I just wanted to take this opportunity, and right after I'm done speaking, I'll email the document to everyone, but to share with staff here and and members of Regional Council a housing needs assessment that we just completed at the City of Kitchener. It was really done for two reasons. It's the first time we've done a comprehensive needs assessment such as this. And it includes, there's 13 sort of key findings that are found that have been identified, and you can see in the executive summary. But it's really been done partially as part of the joint study that is being done around inclusionary zoning with some of the other lower tier municipalities, but also as part of the Affordable Housing Task Force that came out of our own Environic survey and the work that has been identified as part of our City of Kitchener strategic plan. All of that is really being done in concert of recognizing that this is a complex issue that's going to require both orders of local government as well as the province, the feds, the private sector, the not-for-profit sector to sort of step up and help deal with it. I think you're going to find this an interesting read, if nothing else, the executive summary and some of the data that's included. I think some of that work is being done as part of the inclusionary zoning work that the other urban municipalities are doing in the region as well. And I just want to say that in addition to that, the regional staff, Mr. Pettipies, has been part of our task force. And from a municipal perspective, I mean, we're certainly very pleased with the fact that we have our new regional plan in place, and this will certainly allow us to continue to work together and move forward on this important issue. So I'll give this to the clerk to sort of officially leave a copy with the region. Thank you.
Thank you. It's really encouraging to see the city taking such an active role in this. If you haven't had a chance to read the AMO submission that they did back in the summer on affordable housing, although they were speaking to the province, their message was really very, very strong that this is not something that one level of government can possibly tackle, that it will require all levels of government as well as a lot of non-government players as well. All right. Our next meeting is Tuesday, February 11th. We are going to switch things up. We are going to break now and then come back for admin and finance after our lunch. We can do it. We can start. We are going to roll? Okay, then I'll leave it up to you to put us into closed session when you're done. Motion to adjourn. We need to be done by 1. Yeah. What's the problem? Oh.
Okay, let's call admin and finance to order. Any declaration of pecuniary interest? Any delegations? Seeing none. Presentations, none. Consent agenda, 2 items there. Can I have a mover and seconder? Councillor Jaworski, Councillor Kiefer. All those in favor? That's carried. Thank you. Reports for information amendments to the Development Charges Act. Any questions on that? Seeing none. Okay, thank you. Service review, this recommendation, this was at a previous meeting, and then it went back to the service review ad hoc committee, steering committee, and we reviewed it, and it came up with a whole bunch of recommendations in concert with staff that are attached to your report today. Mr. Murray?
Yeah, just a couple of really brief comments to echo what Chair Strickland said. I think the steering committee had a really engaged discussion about what should the region do with each of the 19 or 20 recommendations that came out of the KPMG report. And the attachment to the report, these big pages, lay out the proposed direction on each of those 20 opportunities. Some of them basically involve carrying on with the current approach to service delivery and funding. Some of them involve regional staff from corporate performance and from the program area undertaking a bit of a review. Those are mostly on ones that are of smaller value, where we just didn't think it was cost effective to go and engage a consultant. And then there's a few where the recommendation from the steering committee is we need to do a deeper dive, and we need to go out, we need to engage a consultant to do a deeper dive. And some of those are, I would say, high priority. One is looking at how we deliver childcare services. So that'll be one that gets launched ASAP. Another opportunity is how we provide kind of facilities maintenance services, including how we do all our maintenance on Waterloo Region housing. And that's another urgent one. That's pretty big scope. And that's one where the steering committee and staff all agreed we'd benefit from engaging an outside consultant. The ones where we're engaging outside consultant, we would pursue funding from the province through their audit and accountability fund. And I think on all of these, we've laid out some target timelines to bring reports back to council. A lot of it over 2020, and some of it sliding into 2021. So if you've got questions, I or Craig or Jane will try to answer them, and members of the steering committee as well.
Great, thanks very much, Mr. Murray. And just to add to that, I would agree that it was a very good discussion, and that we took a comprehensive approach. The one thing we also really emphasized that we have deadlines, so you'll see for all those actions have some firm deadlines attached to them. Okay, thanks. So is there a motion there? Can I have a mover and seconder? Councillor Foxton, Councillor Schatz, all those in favor? That's carried. Thank you. Public engagement feedback, that's for information on page 33. Any questions on that? Councillor Harris.
This goes red. Yeah, hi, thanks. One thing I did notice with that, and perhaps for next year just to leave as an asterisk, is that I did notice that there was a fairly low number in respondents, I think, when it came to these surveys, I believe. And I just wanted to know if there's a way we can have more outreach, particularly to our business community, so that we can get a more robust representation of our community when it comes to public engagement feedback, specifically as it relates to budget.
Mr. Dyer?
Go ahead, Craig.
Yes, so through you, Mr. Chair. So as we've noted in the report, this is the third year that we've completed an online portion of the public engagement for the budget. We're, I would say, somewhat encouraged that each year we've been able to increase the level of response. Last year, I think, was 485. This year was just a little bit over 550. So I think, we're generally pleased that we're seeing more response. I think we did have a pickup near the end. We put some extra notices out, I think both through the website, on Twitter, to get just to get a higher response. But we'll continue to look for ways of getting the most response as possible, so that the output and outcome is as meaningful as possible to council.
Yeah, thank you for that. Like, as simple as sending an email to the Chamber of Commerce, Communitech, affordable housing groups, asking them to forward the survey information to their members. So I think that's a good idea. All right, thank you. Information correspondence, that's there. Any questions or comments on that? Other business, it says our next meeting's February 11th, but don't forget we have our budget meeting next week, January 22nd at 4 o'clock. Be there or be square. And before we adjourn, we're actually going into caucus. So I need a motion to go into closed session to deal with labor relations issues. Councillor Harris, Councillor Jowett, all those in favor? That's carried. Any other items, any other business? Okay, motion to adjourn. Councillor McGarry, Councillor Kiefer, all those in favor? That's carried. Thank you very much, everyone.
And Mr. Chair, since I'm not seeing Chris, oh, there's Chris. Chris, you want to just talk about your plan for lunch?
So lunch is chips, so I think the chips are all on your desk. And so you can go and get your lunch, and we'll convene in
Bring your lunch and water.